In this video, I will be sharing with you 5 quick tips to communicate effectively with patients over the telephone. So if you're interested, then keep on watching. So the first tip that I have for you is to always make sure that you're smiling when you're talking over the phone. It's better for you to talk like this than for you to talk like this. At least in my opinion, I think it's a little easier to be able to trust and understand somebody better if you are talking to them in person rather than over the phone. So I think it's very important that you establish that nurse-patient relationship right away when you are first calling the patient. So always introduce yourself with a smile. Even though they cannot see your smile, you can hear a difference in your voice. Also, another thing that I need to make sure that I put here in this video is to make sure that you speak slower than usual, slow enough for them to understand you, because you don't know where they are at, if their connection is good or bad, or even sometimes like the elderly, they have more trouble hearing over the telephone than in person. So make sure you're talking at a slower pace rather than super fast. And if you see me looking down, it's because I have my notes right here. So my second tip is to ask them if this is a good time for you to talk to them. You want their undivided attention, so you don't want them to be like mowing the lawn while they're talking on the phone with you. I mean, they probably can't hear you, but you know what I mean. You want them to be calm, sitting down, somewhere quiet where they can actually hear you and not misinterpret anything that you are trying to tell them over the phone. So make sure to ask if they are able to talk at this time. And if they say no, ask them what time they would like for you to call them back. And that's just a quick little tip. Instead of playing phone tag, make sure to ask them before you hang up with them. If they are unable to talk to you at that time, ask them what time they would like for you to call them back so that you're not playing phone tag. And sometimes what happens is that if they already know it's you, they will not answer the phone. Make sure to like schedule an appointment with them before you hang up the phone. Especially if it's something important like lab values or something. It's very important that you set up an appointment before you hang up. So after you provide the education that you need to give the patient, make sure that you listen to them. So that means do not cut them off abruptly from what they're saying. Let them talk, let them say what they need to say. And once they actually tell you everything that they want to tell you, make sure you reiterate in your own words what they told you so that you both know that you're both listening to each other and that nobody is misinterpreting each other. Because a lot of times over the phone and even in person, there's things that are misinterpreted. So it's just better to make sure that what you're understanding is really what they said. So my 5th tip is to just make sure that you're providing them with enough education and information as possible. For whatever reason you are calling them, make sure that you provide them all that education before you guys hang up the phone. And of course, make sure that you're always asking them before you hang up if they have questions. Sometimes they won't have questions at that time, but as soon as they hang up, they will have questions. So also provide them with your phone number so that they can give you a call back, or a phone number to somebody that they can reach once they hang up the phone with you, because I almost guarantee that after they hang up with you, they're going to have a question, because that happens to me all the time. So give them a phone number where they can either call you or where they can reach the person that they need to talk to. And also make sure that they understand what you told them during the conversation. Just like you reiterated in your own words what they told you while they were talking, ask them to reiterate in their own words to you what it is that you said, to make sure that they also understand, and to also make sure that you chart in your nursing notes that the patient verbalized understanding of X, Y, and Z. So I hope these tips were helpful to you. They're very quick tips that you can do with anybody, not just patients, even with doctors when you're calling them. So I hope that you guys enjoyed this video. Make sure to give this video a like, subscribe, and I'll see you on my next video.